Senator from Virginia.
Mr. President, thank you for allowing me to retake the floor. I'm speaking about the nomination of Congressman Price to be HHS Secretary and reading stories from Virginians who are afraid about what a repeal of the Affordable Care Act would mean in their lives. I will continue. Mark Priest, Alexandria, Virginia. I'm a self-employed entrepreneur and consultant. Since I work for myself, I don't have access to a special pull from an employer that would make health insurance more affordable. Starting in 2014, I was insured through the ACA, and I was able to find an affordable policy to cover myself. I think there's a mistaken notion that if you are employed, you automatically have access to affordable health insurance. The ACA isn't just for the unemployed. I work hard, and I'm a small business owner. The ACA makes it possible for me to afford health care. Constance Birch, Fort Valley, Virginia. I'm a 53-year-old single female who's self-employed as a voice and piano teacher. I've always prided myself on being able to care for myself and provide the basic necessities. Before the ACA, I had to pay over $450 a month for health care on a net income of $19,000. This meant some months having to use credit cards for other necessities such as food and gasoline to get to my lessons. Thanks to President Obama, that all changed, and based on my income, my fee was reduced to $33 a month. I literally cried for joy that someone finally did something to help those of us who work hard and deserve the same quality health care that the more fortunate are able to have. It's fair, and quite honestly, it was the first time in my life that I truly felt that the government actually did something to help me personally and those in the same position. Deb Fuller, Alexandria, Virginia. I rely on the ACA for my health insurance because otherwise I'd not be able to get it. My job writing K-12 textbooks and other educational material has largely been outsourced, and full-time permanent positions with benefits are nearly non-existent these days. The majority of the work is as a flexible workforce, which is a fancy term for freelancer or contract employee. Having the ACA means I can continue working these contracts instead of trying to figure out how to completely change professions because I need a job that provides health insurance. Before the ACA, my saint of a doctor went back and forth with health insurance companies trying to convince them that I wouldn't cost them too much money in the long run. They literally looked for anything to deny me coverage. One rejection letter mentioned cold sores in the litany of reasons why I was completely uninsurable. 90% of the population has cold sores. Now insurance companies make back their money on me because I pay them vastly more than they cover because I don't get sick that often or visit the doctor that often outside of routine checkups. I also have peace of mind that if I'm out on horseback riding or on the trail, I won't be put in the poorhouse because I landed in a heat and had to go to the ER. Lauren Carter, Lovingston, Virginia. My 39-year-old son has cerebral palsy and a blood clotting disorder. His pre-existing conditions started at conception. 3 years ago, he lost his full-time job with health insurance benefits. The ACA allows him to continue receiving medical care and purchase his life-saving medications. He supports himself through multiple part-time jobs, but employer-based insurance is just not an option for him at this time. Shannon Linford, Leesburg, Virginia. My name is Shannon Linford. I'm 24, and from the age of 10, my life has been a series of doctor's office visits. I suffer from more than half a dozen chronic illnesses, physical and mental, and require frequent checkups and take up to 15 prescriptions a day. I've spent the last 14 years balancing illness with my attempts to build a life. That would not have been possible were it not for the provisions of the ACA that prevent insurance companies from denying me service for my illnesses or allowing me to stay on my parents' insurance until I'm 26. I've had to take a detour from pursuing higher education due to my illnesses, as well as getting a job, and instead spend the days I'm well enough volunteering with nonprofits that advocate for others with illnesses like mine. My team of doctors and I work together personally to create a plan that's best for me. We're exemplifying healthcare at its best. They know me by name. They know each other by name across disciplines. They work and collaborate together. I would not have this luxury were it not for the ACA. Insurance companies would deny me coverage due to my pre-existing conditions. and my family and I would go into bankruptcy trying to get basic care. My health is finally under good management. I'm going into remission with my depression thanks to new experimental treatments from my psychiatrist. Things are looking up thanks to the provisions in this remarkable act of legislation. Revoking this law would be criminal and would destroy lives, destroy futures. Thank you so much for your hard work. Anna M. from Vienna asked that I not use her last name. Without the ACA, I'd likely be dead. I live with bipolar disorder, an incurable mental illness that causes my moods to swing uncontrollably from intense anxiety to crushing depression. I began seeking help 5 years ago and once spent 2 weeks in an intensive outpatient hospital program because I was suicidal. I got help, but later lost my job and my insurance, making my disorder a pre-existing condition. Thankfully, the ACA prevents my new insurance from refusing coverage, and I was able to continue treatment. I'll need to control my bipolar disorder with medications and therapy for the rest of my life. Without treatment, I'm at a higher risk for long-term unemployment, becoming homeless, incarceration, dying by suicide. With treatment, I work full-time, pay my taxes, volunteer for local charities, and I'm a loving daughter, sister, and friend. Katie Rugg, Henrico, Virginia. I was paying half the cost of my rent and health insurance every month and still having to pay for services every time I went to be seen. I never knew how much things would cost when I went to be seen either. So I was paying an outrageous amount for health insurance and also afraid to go see a doctor if I had any issues because it was going to cost me more money than I had on top of everything else. I was living a paycheck to paycheck with a full-time professional job in my field and a master's degree and seriously considering going without any insurance at all. When the ACA was passed, my employer offered a discounted option through the Affordable Care Exchanges. I decided it was worth trying. It cut my monthly cost by more than half, and it pays for services at 100% of the Medicare fee schedule. The cost is deducted directly from my paycheck, and every provider that I've seen has been happy with the prompt and predictable payment, even if it requires some explanation at first. The way it works is that I would pay the difference, if there was any, between the cost of service and the Medicare fees payment. So far, any additional cost to me, besides occasional lab work, have been very minimal, and my regular chiropractic care is completely covered. It's been phenomenal, and like the difference between day and night for me. But not only did this option allow me to feel comfortable going in to see a doctor when I had an issue, instead of when I absolutely had to and was already sick, it also helped me put some money away into modest savings. And most importantly, with housing costs continuing to rise and my paycheck staying absolutely static for 3.5 years, I was finally able to buy my own house through a first-time homeowner's assistance loan. It took a year of looking and saving aggressively, but I've done it. I've done it. Losing my ACA insurance would be devastating. I've come too close to homelessness with the financial pressures I face in this economy. I don't want to lose now what I have worked so hard to gain. Thank you, Senator Kaine, for what you've been able to do to help people like me. Sincerely, Katie Rugg. Joanne Loislet, Clifton, Virginia. My story is, I'm sure like many other women, I was a stay-at-home mom, and in 2009, my husband, who owned his own business, and I separated and ended up divorced 3 years later. He's not required to keep my children insured, and he canceled their health insurance without me knowing it. The company I started working for doesn't offer health insurance, and we went without until the ACA went into effect. Our pediatrician didn't charge me for office visits and only for vaccines. When needed, we borrowed money to help pay the bills. If the ACA gets repealed, what would we do? What would happen if my son breaks his arm or my daughter breaks her leg? How could I pay for that? I make $50,000 a year and live in Fairfax County, and I could end up in bankruptcy. We have a right to have insurance and live with peace of mind. Laura Cranus, Mechanicsville, Virginia. My daughter was diagnosed with Crohn's disease in April of 2013. That September, my husband was diagnosed with Parkinson's disease. We're farmers. We raise food for America. As such, we're independently insured. Prior to finding a plan through the ACA in January 2015, our monthly insurance premiums were to increase to nearly $3,000 a month. Yes, a month. On top of that, our health care insurance had an annual cap on prescription coverage of $5,000. The Humira that my daughter takes to combat Crohn's retails for $3,800 a month. And this is not the only medication she needs. So basically, after 1 month We reached the prescription coverage cap, meaning we would have to pay $3,800 a month for her medication on top of $3,000 a month in premiums. Who has an extra $6,800 a month to pay for this? This is way more than we earn every month. With the health insurance plan we got through the ACA, our premiums for 2015 were $1,500 a month, less than half of what we would have been paying. But the real saving grace was no prescription cap. So my daughter's medications are covered with a copay after we reach the deductible. This is still a lot of money, but at least we can treat our daughter's disease and hopefully keep her healthy. And even though our premiums have gone up to nearly $2,000 a month for this year under the ACA, at least we still have insurance. Under the Republican senator's repeal of the pre-existing condition provision, we'll not be able to get, much less afford, any insurance in the future. And this will have devastating consequences to my daughter's health. She's only 15 years old. She deserves a chance in life. And I've not even touched on how our insurance will affect my husband's Parkinson's disease. We are upper middle class income Americans. I'm not asking for a handout. We're paying more than 25% of our income for health care related expenses. And I can't imagine this effect has on people with less resources than we have. Do you know what happens if you get sick or a disease and you don't have or can't have health insurance or medical treatment? You die. Seriously, health care costs are out of control in America. Health care is a basic right, and people are dying. Cynthia Elliott, Hillsborough, Virginia. Governor Kaine, without the ACA, I and many other younger seniors whose jobs do not provide health care would simply be without until Medicare kicks in. I was paying $1,000 a month for HMO care until I couldn't. But with the ACA, I was able to get coverage for a reasonable $300 a month. And this one includes dental care. It is a lifesaver for me. Mary Lloyd Parks, Richmond. We have excellent insurance coverage, though expensive, through my husband's partnership at a large law firm, and we've been grateful. We have 2 daughters now, 21 and 23. Our oldest has cystic fibrosis. The Affordable Care Act has allowed her to stay on her health insurance policy through college, and now in her first years as an urban teacher's fellow in Washington, D.C., where she's teaching first grade and studying at night to get her master's degree in elementary and special ed. While her health is currently good, the medicines she requires to maintain her health are extremely expensive, and without our insurance, she would not be able to afford them. The prescriptions cost thousands of dollars every month. We're quite fearful that when she turns 26, her pre-existing condition, a very expensive and lifelong disease that requires routine hospitalizations and even lung transplants, would make her virtually uninsurable. We are counting on the ACA to be in place when she can no longer be insured as a member of our family. She's chosen a profession that may not allow her to afford the care she needs, and she was born with a chronic serious illness that would be a pre-existing condition that a future insurer could use to deny her coverage or charge her prohibitively high premiums. Just 4 more, Mr. President. Carrie Hawes, Midlothian, Virginia. Sometimes people forget how much is encompassed in the ACA. If not for the ACA, my husband would be dead. Diagnosed with a fatal liver disease at 27, he needed a liver transplant, and he ended up getting 2. On July 19, 2012, he received a new liver at UNC Hospital. He regained his life, and we were able to move home to Richmond to take new jobs and begin a family. Knowing that his pre-existing condition would be covered under the ACA, we were able to live without fear that an employer would deny us coverage because he was high risk. Sammy Newman, Richmond. Before the ACA became law, I was paying more than $1,200 a month for health insurance. Quitting altogether was one alternative, but it would have meant paying possibly double for health care, procedures, and lab tests because I'd no longer be eligible for the negotiated prices contracted by the health insurance company. Still, I was almost out of money. Then the ACA was passed. My rates fell to between $50 and $60 a month for better policies that I had before making the switch. At 62 years of age, I'm faced with health care needs that continue to increase. As a cancer survivor, 21 years and counting, it's imperative that I be proactive regarding health care. In fact, having a good doctor under an affordable employer-sponsored health care plan is what saved my life 21 years ago. Please don't let this lifeline be abolished. Heidi S., Richmond. She asked me not to use her last name. Thanks to the passage of the ACA, I was able to stay on my parents' health insurance plan until I turned 26. This policy change allowed me to go back to school at 24 years old to pursue a master's degree, during which time I was diagnosed with a malignant melanoma. The mole was not of concern to me at all, and it was found during a routine checkup. If I didn't have access to my parents' health insurance during that time, I surely would not have had access to pathologists and surgeons who diagnosed and removed the cancer before it had the chance to spread. While no one truly knows what would have happened had this tumor not been removed, I truly feel that I owe my life to the ACA. And finally, Mr. President, Christopher Woodruff from Bedford, Virginia. Dear Senator Kaine, in September of 2011, I began receiving Social Security disability benefits, not from an injury, but from an illness I was diagnosed with 12 years ago, a rare blood disorder caused by a mutated gene in my bone marrow. I worked as many years as I could, but I eventually became unable to. The company I worked for, insurance plan, had a $10,000 deductible, so for me, having to go to the hospital twice a month for treatment for most of the 12 years, it's taken all of my savings and the retirement I had accumulated to cover my medical bills. 7 years ago, we had to cancel my wife's health insurance due to the high cost. Due to the high cost of medical care, my wife would not see her doctor at times she really needed to. The amount of disability I receive barely covers our basic needs, so she felt she could not afford a doctor bill. But under the Affordable Care Act, she qualifies for a decent policy that costs us $30 a month. This has enabled her to start seeing her doctors again and made her prescriptions for asthma affordable and obtainable again. This coverage is a lifesaver for us, and I'm not sure how I could handle losing it. Please, please, convince your colleagues in the Senate to show some compassion for those who worked hard all their life only to lose everything because they became ill. Thanks for your service. God bless you. With kindest personal regard, Chris Woodruff. This is not a game. This is not politics. This is not a debate. This is the lives of dozens of Virginians sampled out of 1,600 stories that have been sent to me in the last 3 weeks, all saying to this body one thing: do not repeal the Affordable Care Act. Do not jeopardize the health care of 30 million people. Do not jeopardize the peace of minds of parents going to bed at night and making them wonder what will happen if their child gets sick tomorrow or if they lose their job. We can improve, and many of these letters point out things we need to do to improve the Affordable Care Act. But we shouldn't even be contemplating a repeal of a law that provides so much good to so many. And this is one of the main reasons why when we vote later today, I'm going to be opposing someone who wants to repeal the Affordable Care Act, Congressman Tom Price, as he's been nominated for HHS Secretary. And with that, Mr. President, I yield the floor. Thank you.